Deputy Daly first.
Thank you, Cathaoirleach, and thank you for the opportunity to raise this very important issue. And I also want to thank the Minister for coming in to take the topical issue today. This is an issue that I have been writing to the Minister and to his predecessor for some time. I have been representing the views of parents of constituents of mine down in West Cork, and I want to put on the record the name of Jessica O'Flynn, who's 12 years old, and the name of Aoife Murray, who's 17 years old. And both of those young girls are waiting. One of them is waiting since January 2013 to have this operation on her spine done, and the other girl, Jessica, is waiting since October 2013. So I understand from Mr. Kiley, Pat Kiley, outside in Crumlin, that under the current resource system it would take up to 2 years to clear the present waiting list. So obviously that's a situation that cannot be allowed to continue, so I would plead to the Minister. I think it's very opportune at this time that the service plan is being drawn up by the HSE after the budget that we've just had, and I would plead with the Minister to speak with the HSE to ensure that the necessary resources are allocated while they're doing up the service plan for the coming year, to ensure that the waiting list for spinal deformity cases can be dealt with as a priority. It would be much appreciated, because the delays that this can are leading to complications, and I'm not a medic, I know the Minister is, but I understand from Mr. Kiley in one of the cases, he said that given the fact that one of the patients is starting to get respiratory difficulties, if we delay too long, the situation may be a lot more complicated. He also goes on to say that he would be very optimistic that a single-stage operation would correct her deformity, and once she has recovered from the surgery, her life would be quite different, and her overall level of support and function would be much different as well. So, you know, these are real people, and that's the reason I name them here. They're real people, their real lives affected. It's more than just a management issue. It's an issue, I think, for society, that we don't neglect these children, and that as they're growing, the curvatures to their spine are dealt with. So I plead with your Minister to act on that, and look forward to a response in due course. Thank you.
Thanks very much.
I want to thank Deputy Daly and Deputy Creed for raising this important matter, and I'm pleased to take this opportunity to outline the Government's position on this. And in fact, I have a constituent of my own who's on the same waiting list, so I do some understanding of it as a local TD as well as a Minister. Scoliosis in children and young people is predominantly managed at Our Lady's Children's Hospital in Crumlin. The hospital has an agreed capacity to carry out 58 full spinal cases per year as part of its annual service level agreement with the Health Service Executive. A total of 68 full spinal surgeries were carried out in 2013, which is 10 more than was funded. In total, 147 procedures were carried out in 2013. This included children requiring repeat procedures and rod lengthening, as well as full spinal surgeries. Surgery is provided through 2 full-day theatre sessions per week and 10 specialist orthopaedic beds in Crumlin. Currently, there are 2 orthopaedic consultants, each with a half-time commitment to paediatric spinal surgery, providing this service in Crumlin. These are jointly appointed between Crumlin and the Paediatric Adult Spinal Services at Tallaght. Approximately 5% of cases, predominantly those with neuromuscular disorders, will require high dependency unit or paediatric intensive care access after the operation. The average length of stay for a patient having spinal surgery is normally 7 to 10 days. There's been an increase in the number of outpatient referrals for spinal review, and a consequent increase in surgical demand. Hence, waiting times for both outpatients and for those awaiting scoliosis surgery are indeed very challenging. The latest available figures indicates that 1,389 patients are on the waiting list for spinal review, and there are 190 patients waiting for an outpatient appointment for more than a year. When it comes to target waiting times for surgery, there are currently 108 children who are currently waiting longer than 20 weeks for this service. The HSE has prioritised a business case for additional capacity for this service. Both the Department of Health and the HSE are fully conscious of the service needs. The resources requirements to address waiting times and service need are being considered in the context of the 2015 service planning process, which is currently underway. In parallel, the Children's Hospital Group, which comprises Crumlin, Temple Street and the Paediatric Service at Tallaght, is working to identify a comprehensive plan for the utilisation of all orthopaedic resources across the 2 hospitals, that's Tallaght and Crumlin. This would address needs in the areas of trauma, bone cancer and other orthopaedic requirements, as well as spinal services. Both I and the department will work with the HSE to ensure that the service needs and waiting times in this area will be addressed, having regard to the overall level of resources available to the HSE.
Well, good, Minister. Now, Deputy Daly, you have a minute to respond.
Again, and thank you, Minister, for your response. Look, again, I think we've made the case, both myself and Deputy Creed, but it's very heartbreaking to see any parent come into your constituency office. They will do anything for their child, any of us would do for our own children, and they're completely helpless. And talking to parents about resources and issues like that is irrelevant. You know, these are real people, and they're looking at their child. There's a deformity there in their spine. It's curving, and it's getting progressively worse. And I think it's really, really heartbreaking to listen to the parents who feel so helpless and who are pleading with us as their representatives in this House. Those children don't have a voice in here. We're their representatives. And I hope that today we've brought a human side to it, and I absolutely want to endorse what Deputy Creed said. It's not looking for any one name or two names to be taken out of the list. There's 120 children, all of them cherished equally by the state, and I would like that waiting list would be attended to as a matter of priority, and that the necessary resources would be made available during the preparation of the HSE service plan, which is active at the moment.
Thanks, Deputy.
Yeah, this is actually quite an opportune debate, and it is entirely a coincidence, by the way. But I am having a meeting with the Chief Executive Officer of Crumlin in the next couple of hours about orthopaedic surgery, because it is acknowledged that it is a problem. At the moment, there are 12 children waiting longer than a year for scoliosis surgery, which really isn't acceptable. But if we look at projected demand, what we need to increase the number of cases done a year from about 58 cases a year to 120. It's easy enough to deal with maybe 12 cases, but there will be more coming onto the list behind them. So we need to almost double capacity for scoliosis surgery in Crumlin. I don't know enough about how the surgery works or how the aftercare works to say whether it could or could not be regionalised. The risk of doing something in two centres rather than one is that you may not have the specialised staff all the time in both centres, but maybe it is doable, maybe it isn't. But look, it's certainly something that I'm aware of, something that I'm concerned about. We certainly can't allow a situation to develop whereby children's scoliosis, the curvature in their spine, is getting progressively worse to the extent that they're starting to get respiratory problems and neurological problems too. And I understand that is happening. So needless to say, it's something that I'm personally concerned about, and obviously it's something that I hope can be addressed in the context of the service plan for next year.